What's up, guys? My name is Isaac Hernandez. Today I'm going to be presenting my 2025 Global Citizen Research Project. My topic is going to be on medical waste or waste created in healthcare environment, and I'll be sort of illustrating some pictures as I'm talking to sort of ease the process along. So without further ado, let's get right into it. All right, so naturally, as we get started here, the most important thing is going to be to define medical waste, and sources for that information are very important. It's crucial to have an accurate baseline as we get an idea of how this whole operation works, and the best place to get the information for that is through the Healthcare Environmental Research Center. They define themselves as a comprehensive resource covering all the varieties of hospital wastes and all the rules that apply to them. So that's what we'll be using to kind of get this information. All right, so there's several types of medical waste, and the first type we're going to go over is regulated medical waste. This includes biohazardous materials, so things like pathological anatomy, biopsies, pieces of anatomy, bones, things along that line, blood and blood products. That one's pretty self-explanatory. Cultures of infectious agents, so if they take a culture, things that have kind of gone through labs, they're going to want to include that in this category. Contaminated sharps. Although sharps are disposed of differently than a lot of these other categories, contaminated sharps is technically classified as a regulated medical waste, and you can see why it would need to be regulated. Next is isolation waste. These are things that are infected or contaminated with highly infectious diseases, things like Staphylococcus aureus, things like E. coli, C. diff is another one. So things that are very, very strong diseases. You can see I have my little muscly bacteria here. So those are the kind of things that are going to want to be put separate from other things, and that's why they call them isolation wastes. And then the last category is animal-related waste. And animal-related waste is just things that, like lab testing, animals, anything to do with a non-human biological material. A lot of the times it's mice, things that are used in testing, and so that is the last of the things that are included in regulated medical waste. This next classification of waste is so evil, so diabolical, so infamous, and so hazardous that it cannot be included in the previous classification. Hazardous waste. So yeah, these materials are considered to be especially dangerous and they require different precautions. There are 6 factors to consider that determine if it classifies as a hazardous waste. Is it solid or contained? Is it excluded via a regulatory exemption? Is it part of the list of specifically determined hazardous wastes? So is it listed? And then the next one is very important. Is it characteristic? And I'll kind of expand on this one here in a second, but I would say that this is one that you definitely would want to watch for in terms of the importance of all 3 of these. Next would be, is it mixed with another hazardous waste? Is it part of a mixture that contains a hazardous waste? Because that could also classify it as hazardous, even if it's not the entire solution. And then does it derive from a hazardous waste material? So is it a byproduct of those things? So yeah, moving on from the characteristics, I just want to expand here. This is really good in determining the things that you would consider to be a hazardous waste. It kind of helps you get an idea of the types of materials and things. First is ignitability. So is it something that, is ignitable, possibly explosive? Corrosivity. These could be things like batteries, things that have battery acid, lots of acids or chemicals that will corrode the environment. Reactivity, that one's pretty self-explanatory. Is it reactive? And then lastly is toxicity. Is it something that is toxic to the environment? Is it toxic to, humans or people that are around it? And so those 4 classifications are essentially giving you an idea of the types of things that you would see in the hazardous waste category. All right, so if a material is determined to be hazardous, whether it be from being on the list or having some of the characteristics that we listed, then things will change. So the storage, the amount of time that you're allowed to store it will change. There'll be regulations based on the quantity that you're allowed to have. And that'll all be based off your generator status, which just breaks down to very small, small, and large, meaning how much do you produce of these materials. And emergency planning will have to be implemented, and employees will have to be trained on what to do with this material. Regular routine inspections will be implemented, and regulations on shipping as well as a manifest will be required as these materials are more dangerous to transport. The next category is pharmaceutical waste. It can technically be broken down further into hazardous and non-hazardous via the same categorizations that we saw earlier with the hazardous waste category. However, the larger focus is typically going to be on hazardous pharmaceutical waste because non-hazardous is non-regulated, and so it's more similar to a regular solid waste that can be sent to landfills. So because it is a hazardous waste, pharmaceutical hazardous waste will have key distinctions like regulations, management, and disposal that are a little bit different. So before we move on here, I want to kind of zoom out a bit and clear some confusion by illustrating to you the dynamics of these wastes. You might have noticed that regulated waste is a category and pharmaceutical waste is a category, yet there's both regulated pharmaceutical and non-regulated pharmaceutical. You might also notice that hazardous waste has some similar cross interactions. So basically, healthcare waste is broken down into regulated and non-regulated. And this is a subcategory distinction that's probably the first that you're going to make when it comes to the general waste. So non-regulated is going to be broken down into solid and non-hazardous pharmaceutical waste. Next is regulated. That's going to be broken down into your regular categories from before, but also hazardous wastes. So hazardous pharmaceutical waste would be included in that. Now notice that pharmaceutical waste, because it is a subcategory of waste and it can be broken down into hazardous and non-hazardous, it kind of has a distinction where part of it is regulated and part of it is non-regulated, and you'll see that with several other of those kind of categories. And so hazardous is a distinction that's only made on regulated waste, as you can see here. So I hope this picture zoom out kind of helps you get an idea. So what happens to these various types of wastes? Well, for solid waste, non-hazardous pharmaceutical, and other specific wastes, basically anything that's not regulated, they're sent off to landfills, recycled, taken care of in the various ways that you would expect. The problem lies whenever you run into wastes that are a little more complicated and a little more dangerous. So those items would fall under regulated medical wastes. These items cannot simply be disposed of because they pose an ecological risk when the right measures aren't taken. For this reason, states and federal agencies work together to decide things like classification, storage, and transportation of the materials, while other organizations like EPA, OSHA, and DOT help to enforce the same regulations. So what are some of the ways that we can dispose of these things? Well, if you've worked in a sterile environment in the hospital before, then you probably already know the answer to the question: heat or chemicals? The chemical option involves treatment and sterilization, which can be convenient but produces chemical byproducts that can be potentially harmful. For heat, items can either be completely incinerated or thermally treated in autoclaves or microwaves. Large and industrial microwaves are typically used, not like the corn dog heating up kind you probably have in your house. Incineration is faster and more efficient, but exposes a lot more pathogens into the air and poses a larger environmental concern or risk. Microwaves and autoclaves are safer with less air moving through and have a lower carbon footprint, but are expensive and slow comparatively. Due to environmental concerns, medical waste items are typically transported to heavily regulated larger processing centers before being treated rather than being done on site. Medical classifications such as sharps, microbiological waste, and isolation wastes can have special precautions for disposal depending on the state. All right, so now that we've kind of explored the ideas of waste regulation and management, it's time to look at the other end of the spectrum here and kind of take a look at how we can be preventative in nature and look at waste management. Nothing beats proactivity in these types of situations, and waste reduction is key when looking at the whole picture of medical waste management. And so, waste reduction is actually ideal for a few reasons. First and foremost, it reduces stress on regulatory agencies. The less waste that we're producing, the less that they have to be involved. Second, it's going to reduce economic burden on the hospitals. So, obviously, the more waste you have, the more you have to pay to have it disposed, and the more you have to pay for the items that you are not using or that you are wasting. And lastly, it goes without saying that an ecological footprint is better without more waste. So it will reduce our ecological footprint and health environmental risks that we've talked about previously. But how exactly do we go about doing this? Well, there's a few things that you can do that have been highlighted on the HERC website. You can buy in bulk, buy only what is needed, so don't buy unnecessary things. I'm sure hospitals you've seen have a lot of things lying around. Get things that are reusable when possible. It's not that much more work to just use reusable things. Reduce unnecessary wastes, and be especially careful with hazardous materials and use substitutes when you can, because the more hazardous materials you use, the more disposal you have. All right, so now that we're all bona fide healthcare waste experts, let's pivot a little bit and visit the WHO website. The WHO is the World Health Organization. They're essentially a United Nations agency that kind of leads global efforts to promote health and prevent disease and things along that line. And I have a couple of quotes here that help you get the scope of the type of data aggregation that they're responsible for. So every year, an estimated 16 billion injections are administered worldwide, but not all of those syringes are disposed of properly afterwards. The other one is open burning and low temperature incineration of healthcare wastes can, under some circumstances, result in the emission of dioxins, furans, and other particulate matter. Right, so that kind of gives you an idea of who they are. They're concerned with healthcare waste disposal, ecological impact, health impacts. And so we're going to use this website to kind of explore some key ideas like what are the health risks associated, what are some reasons for failure of management, and what are some ways that we can possibly improve. All right, so let's talk about the health risks of healthcare waste. So as you can see from our quote above, 16 billion injections are administered worldwide, but not all syringes are disposed of properly. You can imagine that bloodborne pathogens spread more easily through these needles if they're being reused. HIV, hepatitis, things along that line are more likely to spread. According to the WHO and UNICEF, only 25% of health facilities had basic healthcare waste management services, and that's as of 2021. So worldwide, it's a big problem. Next is pharmaceutical. We talk a little bit in the first section about, these drugs needing to be disposed of properly. And you can probably imagine that them being spread out into an area, it could be potentially dangerous for people that are encountering them. Next is chemical. It's pretty self-explanatory. Some of these chemicals are very dangerous. Think of mutamycin or, some of these more dangerous or more toxic chemicals. And then obviously air pollution, which we'll kind of go into a little depth more about later. But essentially, these burning and stuff you can see from our second quote, when they're burning these things, other chemicals are being released into the air and polluting the environment. Next is radiation. That one's pretty self-explanatory. Radiation can leach out in times whenever it's not properly managed. And then antimicrobial resistance, probably the most interesting of all of these. And this is essentially whenever antimicrobial drugs and antibiotic drugs are improperly disposed of, and it leads to these pathogens being able to build a resistance to these antimicrobial and antibacterial drugs. And what I want to briefly do for a second is take air pollution and kind of use it as a springboard to talk a little more broadly about the environmental and climate impact of these healthcare wastes and dive a little deeper and show you kind of some of the ways that these things are affecting us. So not only can they contaminate the water, they can cause chemical leaching into water sources or into air sources. There can be air pollution, and there can be CO2 emissions from incineration that will also impact the environment. And lastly, the burning of a lot of these materials will also cause leaching of toxic metals into the surrounding air. And so it's really a larger problem here because we're not only talking about pollution of the air, but we're also talking about pollution of the environment and the furthering of climate crisis factors. So in terms of addressing the question, why does waste management fail? I think nobody is better than the actual WHO website themselves at providing a concise statement as to why this happens, and so I will be quoting them directly. They state, and I quote, "Several reasons exist for inadequate healthcare waste services. These include limited legal frameworks, lack of awareness about health hazards related to healthcare waste, inadequate training and proper waste management, absence of waste management and disposal systems, insufficient financial and human resources, and low priority. Many countries either do not have appropriate regulations or do not monitor and enforce them." End quote. So yeah, that pretty much sums it up very well. So how do we improve on this situation, or as the WHO puts it, the way forward? Well, first and foremost is waste reduction. We kind of talked about this a little bit earlier, some of the methods we talked about. Next is going to be regulation and oversight. And so a lot of these things need to be regulated. As we talked about earlier, certain percentages of the world are not even having proper waste management services or protocols. Next is safer disposal methods. And so this has to do with disposal, but as well as The destroying or incineration of these products we talked about earlier, microwaving is one of the alternatives that we have, and although it's more costly and takes longer, it does have less of an ecological effect, and so opting for things like that is going to be crucial in the future. Next is strategies to increase awareness, things like what we're all doing here with these projects and, spreading the awareness like the World Health Organization is doing. And the next is going to be proper training and protocol for people who work in disposal. So people that work in disposal need to have the support from the companies that they work for to be able to safely transport and handle these materials. Last is government involvement, and as the WHO puts it, government commitment and support is needed for universal long-term improvement. So I know you're probably used to my formatting by now, but if you allow me to jump scare you for a second, I just want to highlight these two organizations that we've been using for reference in this project and show some of the active ways that they're implementing plans and things that are more actionable that you can look to on their sites. To get a reference for health waste management. On the left hand side, we have the P2 protocol from HERC, and on the right we have the WHO Safe Management of Waste from Healthcare Activities guidance document. And these are two great references and two great examples of ways that we can move forward. So check those out; they're on their respective websites for your reference. And so now we're on to the part of the video that I've been the most excited to talk about. And this is about an article that was published in the American Journal of Infection Control by Dr. Maya Al-Munif and Dr. Ziad Amamish in June of 2003 out of Riyadh, Saudi Arabia. The title is Effective Medical Waste Management. It Can Be Done. So essentially what happens in this article is that there is a 600-bed medical center in Riyadh, which by the way is larger than pretty much every hospital in Austin in terms of bed volume, where they noticed that a ton of medical waste was being incinerated to the point where it was running night and day, almost nonstop. And all this time it's creating soot and other emissions, and so they decided to implement a plan. First, they contacted major agencies like the EPA and the CDC to make sure that they were in compliance and to get an idea of what their plan of action should be as a collaborative effort. Additionally, they made sure to stay in compliance with the cultural regulations and mores, such as burying the dead in Muslim tradition, as to remain culturally sensitive as possible throughout this process. It's worth noting that this is something that American hospitals would not necessarily have to have as a hurdle, and so this is an additional hurdle that they had to deal with. And when you see the results of this, as I'm talking a little bit later, you're going to be even more impressed, seeing as to how they had an additional hurdle. So next, they took baseline data and interviewed management in all departments to see what ideas they had on how to reduce waste. One of the most important ideas of this article that some of the staff had was taking infectious waste, or was considered to be infectious waste, and it was all previously put into these orange bags, and what they did was they decided to color code it and sort that waste. So once that groundwork was laid, they began to create and implement staff education and a written policy on waste management so that everybody was on the same page. This included things like auditing and sorting of infectious waste via those same color-coded bags that I had just previously mentioned. So the crazy thing is that this strategy revealed that over 50% of the previously unsorted material was considered to be non-infectious waste once it was sorted. And so as a result of the implementation of this program, they were actually able to reduce their cost per year by 17,936 USD. And that's with 5,262 of that coming from fuel costs from burning incinerators alone. And so you can kind of start to get an idea of the scope of this. Over the course of a year, there's a 50% reduction in the amount of fuel even required. And the largest metric, or the most shocking of this, is that there are these buckets that they use as a unit of measurement that are called skips, and they weigh about 100 kilograms, and they hold these infectious waste materials. Typically, over the course of a month, they would use 609 of these skips that would be incinerated, and they managed to reduce that to 256 skips per month. So the reduction was immense in the amount of waste that they were able to reduce just by implementing these policies. And so you might be thinking to yourself, well, that's all fine and good, but how can I enact change personally, on a micro level? And that brings me to the next article, which is published by the British Broadcasting Corporation in August 13th, 2020 by Hope No. And the title is How Do You Fix Healthcare's Medical Waste Problem? And so essentially, this article follows a young surgeon from a trip from a poorer country in the Philippines to a more wealthy country in Singapore. And essentially, she notices that a lot of the materials, namely single use plastic retractors and things along that line, are not being reused. And she essentially takes it upon herself to collect these devices that would have been thrown away or, would have been basically wasted. And she, works with the hospital and with some of the staff that she works with to take these items and reprocess them and re-sterilize them and have them transferred back to her old location in the Philippines where they can be reused multiple times. And she kind of redefines or questions the idea of these single-use devices. And this is something that I've actually personally seen in my clinicals at St. David South Austin. There are a group of travelers that collect these re-sterilizable items, and they take them on their medical mission trips to be used multiple times. And so this is another way to affect change, lengthen the life of some of these items, and reduce waste. All right, so that concludes the informational section of the presentation, and now it's time to take on a more reflective tone. Before fully diving into the subject, I had a pretty superficial level of understanding when it came to healthcare waste, and I remember many times being appalled by the amount of waste produced in the OR and wondering what could be done about it. This project has changed my perspective by a significant order of magnitude. I've changed my mentality from what can I even do to how can I get started, which is an empowering paradigm shift. From seeing the process on a macro lens and knowing organizations like HERC and WHO who are actively working on fixing healthcare waste systems, to looking on the micro and seeing how surgeons and surgical techs can save single-use instruments and reuse them or implement small practices like those in Riyadh that make a huge difference in the larger scope. Examples like these can be the powerful knowledge that tells the surgical tech that their small decisions make a difference in the long run. I personally plan to implement the practices I've learned about today as I continue on in my career. And for anyone still not convinced, I'll end with this. The hospital in Riyadh study had about 6,000 employees. Over the course of a year, they reduced their waste by 58%. That equaled out to roughly 35,000 kilos of waste per month. When you divide that up per person, that's roughly 13 pounds a month or 156 pounds a year of waste that we have the power to stop from being created.